Hello everyone. In this part 2 of the Eastman correction, we'll talk about what are the limitations of the Eastman correction. In the part 1, we talk about how does the posterior or interior position of the Nasion and the vertical position of the Nasion varies and affect the SNA value. So, for example, a patient present to you with SNA 85. Okay. So, will you start applying the Eastman correction? In the Eastman correction, they are taking the SNA 81 too much seriously. For example, in your clinical situation, the Nasion is perfectly positioned and you have a actually prognathic maxilla, and SNA is actually describing the position of the nasomaxillary complex or the position of the A. So the limitation of the Eastman correction is that every time they assume and start correcting the position of the Nasion and not taking a point too much seriously. Okay. So what actually we need to do? We need to apply the Eastman correction intelligently and correlate with the Wits value that are taking the position A point and B point on the functional occlusal plane, and match your finding with the clinical examination. You could say and write in your exam that the patient has cephalometrically class 2 or ANB is this, but the Wits value is this. And there is a clinical possibility that the Wits value may not be correlating with the ANB value or with the Eastman correction, and there is a possibility that the clinical examination and the clinical findings of the face on the profile view may not be matching with the finding of the ANB after Eastman correction, because the Eastman correction is relying too much on the average of Caucasian patient that SNA is 81. Okay, so we cannot apply the Eastman correction blindly. We have to correlate the findings of the ANB and the Eastman correction with the Wits value and with the clinical examination finding as well. So every time you need to mention the ANB is this, after Eastman correction is this, Wits value is this, and the clinical finding on the profile examination, that's the situation, because not every time we need to treat the numbers of the cephalometric finding. We need to treat the patient, and for me the most reliable finding is a clinical finding and the clinical impression. These values are limited, and these values are influenced by the positions of the landmarks. Thank you very much.